Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the vlog post about cancer crowdfunding. What every patient needs to know: why do cancer patients utilize platforms such as GoFundMe? That's a crowdfunding platform. On the one hand, I believe the reason why I wrote this post was simply to educate patients about the concept of crowdfunding. At the same time, I was hoping to educate patients about the pros and cons of crowdfunding. There are many online platforms, online groups that don't allow crowdfunding requests. If you've started a crowdfunding site, you might not be able to post that depending on which online platforms online groups you use. It's also important to me. It's very common, according to the study linked in the blog post about crowdfunding. It's important to understand that we all have high hopes with our, in this case, for example, our crowdfunding campaign, our GoFundMe campaign. Perhaps our goal is $5,000, for example, though it's common for the goal not to be reached. Financial toxicity is essentially that concept that explains that managing cancer is quite expensive, as we all know. And it can be expensive for years to come. While crowdfunding might help initially, it's not a permanent solution. There are grants, there are organizations that allow chemotherapy regimens at a discount. There are a number of things. There are many blog posts that I've written about how to help defray the financial toxicity of cancer care. So my discussion of crowdfunding essentially is designed to discuss the entire topic in an effort to educate cancer patients about, well, financial toxicity, about the expense side. And let me just for a second, in the beginning of my own cancer care, I did exactly what you're not supposed to do. Essentially, I was angry, depressed. I was focusing totally on my cancer treatment. I was essentially ignoring all the letters I was receiving from my health insurance. They were all EOB's, explanation of benefits. That's a mistake. Do as I say, not as I do. Essentially, I was running up a huge amount of debt without acknowledging any of it. I'm urging you not to do what I did. And in fact, these days, there are many more ways to pay for cancer care in addition to health plans. So it's in the patient's best interest to learn about financial toxicity. It can be a very serious side effect of cancer. It's not pain, it's not skin related, it's not chemo rain, it's not any of the normal side effects, but it's very real. Studies show that financial toxicity can hurt how patients deal with their cancers. It's every bit as difficult as cancer pain. So, my point is, if you have any questions or comments, scroll down the page, click through, ask me a question or comment. I'll be happy to get back to you ASAP. In the meantime, thank you for your time and attention, and hang in there.